Welcome back, my people. Let's continue with our discussion, whereby we have been talking about sexually transmitted infections. But before we continue, guys, let me appreciate you for the continued support you are showing me. Thank you for the subscriptions. Thank you for the likes. Thank you for the comments. And those who are sharing my videos, I do appreciate a lot. And I know this channel is going to help the community in one way or another. So let's get back to our point of discussion, whereby we are discussing about sexually transmitted infections and sexually transmitted diseases. And in this video, we'll be talking about sexually transmitted infections and their treatments, or their mode of treatment, or how you can manage a person having a sexually transmitted infection or an STI. So in the treatment available, it depends on the kind of bacteria that has caused the specific STI. Chlamydia and trichomoniasis are cured with antibiotics. Chlamydia and trichomoniasis are cured with antibiotics. Gonorrhea can be cured with antibiotics. However, some drug-resistant strains of gonorrhea can be difficult to cure using antibiotics. Syphilis can be cured with antibiotics, but the medication depends on the stage of syphilis. Remember, while we were tackling syphilis, we mentioned the 4 stages of syphilis. So treatment modality for syphilis will depend on the stage, because each stage has a specific mode of treatment. I hope you get that, guys. So the next, or number 4, acute hepatitis B. It doesn't, this is viral, it doesn't require any form of treatment, because your immune system will fight it back. So acute hepatitis B doesn't require treatment, but if it doesn't clear on its own, antiviral drugs are used to cure chronic hepatitis B. I want you to get a difference between this chronic and acute hepatitis B. Acute is whereby it comes abruptly, but chronic is something that has been there for a while. So if something is chronic, it has more side effects or complications than acute. Because acute it means that it's a sudden onset. A point to note, some conditions are not curable, but treatments help reduce the symptoms. Some conditions are not curable, but treatments help reduce symptoms. Herpes, human papilloma virus, HIV fall in this category. Which category? The category that you just give treatments to reduce the symptoms, but not to cure them, as they cannot be cured completely. So for herpes, antiviral will shorten the outbreak. Antiviral will shorten the outbreak of herpes. Daily antivirus are used to treat HIV and stop the virus from replicating in the body. Daily antiretrovirus or antivirus are used to treat HIV and stop the virus from replicating or multiplying in your body. Within 6 months of treatment, and this is very important, within 6 months of treatment, the virus become undetectable in most people, and this will majorly depend on your immune system and your diet. And also for those who do exercises, it helps to boost their immune system. So what are the preventive measures you can apply to an STI? Number one, the only effective way is to abstain. The only effective way is to abstain from sexual activity, but there are some other ways to reduce the risk of contracting a sexually transmitted infection. Because if we talk about abstaining, how many of you can abstain from sexual intercourse? Let somebody lie to me. He or she can abstain for years. So there are ways which can be used to reduce the chances or the risk of contracting an STI, for example, HIV virus. And what are some of these methods which can be applied to reduce the risk? Number one, which is very common and very obvious, use of condoms and other barrier methods correctly. The keyword here is correctly. It's not just a matter of using a condom, but using it correctly with other barrier methods reduces the risk of coming in contact with the body fluids. Remember, the HIV virus is only carried in the body fluids. Number two, get tested regularly. Get tested regularly and encourage your partner or partners to do the same. Number three, have an open conversation with your partner. For example, if you get a new partner, for those guys who like moving from one lady to another, if you get a new catch, talk to her about sexually transmitted infections. Get the history from her if she has ever had such kind of an infection, and most probably you can go for testing before you indulge in sexual activity. Number four, consider getting vaccinated against human papilloma virus. Consider getting vaccinated against human papilloma virus and hepatitis B. Number five, if at risk of contracting HIV virus, speak with your healthcare provider or your doctor about a preventive treatment called post-exposure prophylaxis. Post-exposure prophylaxis. A point to note, most sexually transmitted infections can be treated if not cured. Most sexually transmitted infections can be treated if not cured, and regular screening to ensure any infections are treated promptly. Most sexually transmitted infections can be treated if not cured, and then regular screening to ensure any infections are treated promptly is important. Guys, this marks the end of our discussion today. In our next video, we'll be discussing about how you can contract a sexually transmitted disease without necessarily having a penetrative sex. Or what are other ways you can contract a sexually transmitted disease without necessarily having a penetrative sexual intercourse? Thank you for your time. Thank you for your cooperation. Thank you for being with me. Let's continue subscribing, liking, and sharing. And if you subscribe, make sure you put the notification bell on, so that if I post a video, YouTube will automatically notify you, so that you may not be left behind. Thank you for the support, and let's keep the support on. Have a good evening.